Okay, now we're going to work on the ecology of human performance, EHP. This model was developed by Winnie Dunn at the University of Kansas Medical Center. It was developed, she is an OT, but it was developed as an interdisciplinary model of practice. She made it fairly simple so that people of other disciplines could understand it, and the way she broke down occupation was for that same reason. Very context-based. Um, it is a very context-based model. Um, she used the ICF instead of the OTPF, but you will see a lot of her terminology in both the ICF and the OTPF. So some of the other people that have used this are special educators, counselors, and rehab specialists. Okay, so it is based on ecology, and ecology is a fundamental assumption of the model. Ecology affects human behavior and task performance. The definition of ecology is the interaction between a person and the environment or their context, and it is the lens through which a person views a task, performance, opportunity. So the basics of this model is people and their context are unique and dynamic. Performance can only be understood via one's context, and a person's performance is defined by the transaction between the person and the context. And she has four main constructs: the person, the task, the context, and then the person, context, task, transaction. So this is for varying ages. It is another one that's across the lifespan. This is considered a preventive. It can be used as a preventive model, health promoting model, rehab intervention approach. Um, this is looking at task performance. So notice the word task. Um, it's broken down into tasks that turn into multiple tasks will turn into an occupation. And the situation or context is the focus for the analysis. Okay, so the person has unique skills and abilities, and in this model it's broken down into sensory motor, cognition or cognitive, psychosocial, and then the transaction between the person and environment is considered to be in constant change. And okay, tasks are objectives, or is an objective set of behaviors necessary to accomplish a goal. And you can have an unlimited amount of tasks. There would be a different amount of tasks for each occupation or groups of occupations. I'm sorry, groups of tasks. Task demands can be internal or external, meaning that internally you have the will to do things, or maybe you've got some sensory stuff going on that would place demands on your task, or just the motivation for it. Internal variables can determine the ability to access the task, such as the cognitive abilities. Roles and social expectations shape the behavioral expectations. So what that means is if you hold a professional role, then your behaviors are, or the expectations for your behaviors are to be a professional. Transactional, the transaction of the person, task, and context is how occupation is developed, and that's how they see occupations in this model, is when the person, task, and context have transacted. Organization of the transactional tasks result in role and occupational performance. So the outcome of that transactional occurrence is role performance and occupational performance. So that's what they're looking for here. Okay. The next is you have context in temporal and in environmental. Well, you have a temporal and environmental context. Temporal meaning time, can be by age, it could be stage of life, life cycle, such as parenting, education, career, that can be across the life cycle. Could be disability status, where you're at with your disability, if it is a declining disability. It could be an improving, maybe you are ill and you're getting better, that type of thing. Okay. The other types of environment is physical, social, and cultural, just like we've seen in several of the other models. Um, Now it's talking about the person, context and task transaction. It is a major variable in task performance. So I said that just a second ago, how these three things act is what actually measures the task performance, or what determines what the task performance is going to be. Ecology is the relationship between the person and environment which affects the task performance. It can be a support or a barrier to the task performance, and the task performance in turn affects the person, the context, and the person context transaction. So if they're able to do that task or perform that task, then that causes the person to feel good about it, and then they could make a difference in their environment, um, and it becomes easier for that transaction to happen. Or if they struggle with it, then it could be a barrier to the environment, cause damage to the environment, or maybe even not. It could just stop that transaction altogether. Okay. So this interaction leads to human performance. Ecology affects the task performance, where task performance in turn impacts the person, the context, and the person-context relationship. You're going to have to read that again and think about that to where it makes sense to you, because it's kind of like a cycle. So it's very interactional, and you're going to have to read that several times to make it make sense. You may even have to draw it out. Sometimes I have to draw things out so that it makes sense to me. But I'm going to read it one more time. The interaction leads to human performance. So this interaction between these three things, the person, the context, and the tasks transactions, leads to human performance. The ecology, which we said was the relationship between the person and the environment, affects the task performance. The task performance, in turn, impacts the person, the context, and the person-context relationship. So it is just a cycle. I recommend you write that down and look at it. Okay? So human performance is a transactional process through which the person, the context, and the task performance affect each other. And again, it's transactional. There was another one that was transactional, and that was the PEO. Same thing. The person, environment, and occupation were very transactional in this one. And in that one, sorry, not this one. This is the person, the context, and the task performed. So not occupation, but task. So each transaction influences a person's future performance range and options, because the person, the context, or the available performance range may be modified by the context or a particular person variable. Okay, so what this is saying is that the performance range that you see in this model, it's kind of like a light beam. It can get really big or it can be really small according to what the person is able to do. And the things that limit the person from doing their task or their occupations is the person themselves or the environment. And the way to fix it is to fit the environment to the person. So that's how they're looking at this model, is by fitting the environment to the person's performance range, thereby increasing their performance range. Okay. So the person context match is the most apparent performance issue and is called performance range. Okay. The performance range is fluid and changing across time as the person and context features change. So as someone gets older, their context changes. They may move. They may live in a different place. We said it was temporal, so things change as they age. They may not be able to get around. They may not work anymore. They may stay at home more. So their context is constantly changing, and they have to learn to adapt to their context. Okay. So there are some assumptions in this model. We have ecology is the interaction between the person and their environment, and the relationship significantly impacts human behavior and performance. Human behavior or performance can best be understood by examining the relationship of the person, context, and task, and persons are viewed from a systemic and a systemic and holistic model rather than the sum of their separate parts. So when we look at the person and we get an evaluation, we're going to look at this person for the first time and talk to them. We're going to find out what type, what do they like? What are the things? What makes up this person? What is this person's goals in life? What do they dream of? That's what we want to make sure that we are trying to give them back. We want their performance range to be as big as possible. Okay. Performance occurs when a person acts to engage in tasks within a context, and persons use their skills and abilities to look through the context and select the preferred tasks. So you'll see the model where the person is standing inside the circle, they're standing inside the context and they're looking out. And it's almost like that performance range is like a beam of light that they're looking out into. The performance range, or the number and types of tasks available to the person, is determined by the interaction between that person's variables, such as their skills, abilities, motivation, and the context variables such as supports and barriers. So EHP emphasizes the situational and external factors. And a person's performance range is based on the transaction between the person and the context or their ecology. For performance range, the interaction that occurs between the context and the person contributes to an individual's sense of meaningfulness. So what they want to do, what they can do, is what is meaningful to them. And we want to do as much as we can to help make that meaningful. So Their performance range can be narrowed because the person may have limited skills and abilities and therefore unable to utilize their available sources. Or it can be narrowed when the context resources are limited. And it is through the engagement in the task that the person and context transact. So they have to engage for there to be that transaction. The person is an individual with unique skills and abilities in sensory motor, cognitive, and psychosocial variables. So there's your person broken down there. Precise predictability about one's performance is unlikely. So what they're saying there is you're not going to be able to know exactly what that person's going to be able to do. You're going to have, it's going to be trial and error. The meaning a person attaches to tasks and contextual variables will highly impact one's performance. This just goes back to using occupation as a means and an end, meaning that what is important to them is what we will do with them as therapists. And the person is an individual with unique skills and abilities with sensory motor, cognitive, and psychosocial variables. Precise predictability about one's performance is unlikely. I'm repeating the same thing here. The meaning a person attaches to the task and contextual variables will highly impact one's performance. And tasks can be novel or routine. Interaction effect is ever evolving and changing. So some of this stuff is being repeated in here. So when you go to write this in the concept, in the table that you're going to put it in, make sure you don't copy it just straight from from here, because a lot of it again is repeated. A person's variables are continually changing and impacted by past interests and experiences. Skills can be gained and or lost due to illness or stress. Contexts are dynamic. We've said that. Persons and context have a reciprocal impact on each other. So we've said that there's a transaction, so the person can affect the context can affect the person. The same person can act differently in different contexts. So we were talking about when you're considered a professional, you act professionally, but then you are the same person that you might go to a party and act totally different. So according to what context you're in, that is how you act. And the same context has a unique meaning for different persons. So someone that may not be professional may be at the same place that you are, but they're not acting the same as you are. The transactional relationship among persons, task, and context constitute occupations and roles. Life roles are a constellation of tasks. Okay, so this is when you're looking at the picture and you see all the T's, and hopefully I'll show you that here in a minute. You'll see all the T's all around the picture. Those T's are the individual tasks of the life roles. So your life role as a occupational therapist has many tasks involved in it. And you can take those tasks and circle them, and within that life role, what is it that you need help with? What is it that is not being supported by your environment or your person? That is where you begin to work with them. And the tasks can overlap into many roles. So you might have some of the same tasks that you need to be a professional or a therapist that you would to be a mother. So those are all different roles, and the task could be the same. Performance in natural context is different from simulated situations. That just makes sense. Assessment and intervention best shows a person's natural performance when enacted in vivo. So they're saying this because they want us to treat our patients in the context in which they are having the problems. What they're saying is by just doing it in a clinic is not cutting it. We need to really treat them in their environment. Simulated context may inhibit or promote performance. Sometimes maybe it would promote it if they're afraid to be in that environment. So sometimes you can look at it that way too. All right, occupational therapy, empowering individuals by enhancing self-determination and inclusion of persons with disabilities in all contexts. It's client-centered and includes making changes in systems so that persons with disabilities have full rights and privileges. So this model does put it is enabling occupation. So it believes that we set up the environment so that someone can be successful. That's what that's all about. Independence is defined as using contextual supports to meet a person's wants and needs, and adapting and altering the environment is seen as an effective means of therapeutic support. So what does function look like? Persons who show healthy function have a high performance range of tasks. So that means that that beam of light is very wide and their roles all fit within inside it. There's none of those tasks that are out there that they cannot do. They show various abilities and interests, and they can integrate the expectations, the supports, and manage the barriers of the context. So there may be barriers out there, but they can handle them on their own. So they would not require the interaction of a therapist. And the people can fulfill the task requirements that are part of their life roles. And dysfunction is just the opposite. It is evident when there exists an imbalance among the person, the context, and the task. If the person's unable to participate in meaningful tasks, if there's a problem in the person, um, if the transaction is not going well between the person and the context, there could be an unbalanced relationship in the in ecology. And then how do we make that change? Well, the change is made through motivation, that is enhanced by directly asking the person what he wants. We need to know what they want, and we need to put them where they want to be so that they can make that change. Persons are likely to engage in tasks if they have an interest or see it meaningful. And then EHP does have their specific checklists. They do have some worksheets that they work with too. EHP also moves along a recovery line or in context, which means I'm going to get to that in just a second. So another thing, their assessment, they do have some assessment guidelines. So you should identify and prioritize the person's wants and needs. You need to do a task analysis, because we're talking a lot about task here, of the designated task, and understand the skills that are required. You need to know if they have a role, what's the role and what are the tasks required for that role. You might have to do a little digging to figure that out. You may even have to go to a job site with them. You need to do a lot of observation and evaluating the client's present functional performance. Okay. This is saying the same exact thing that I just said, so I'm not going to repeat that. So now we're going to talk about intervention. And you need to bring in the person, the family, and you as the practitioner are going to collaborate together regarding intervention. And the goal is to facilitate occupational performance here, whereas participation was talked about in the CMOP-E, but it was implicit, and engagement was the big deal there. This is actually performance here. We are looking for their performance range. So it's performance here is very explicit. So that's the difference between EHP and COPM. I mean CMOP, sorry. OT practice involves promoting self-determination. So we are trying to get this person as independent as possible in whatever way possible. They are suited, this is suited for persons of all disabilities. So even a quadriplegic, this is really good for those clients that are very low level. I would use this for someone, maybe even someone who is progressing in a disease process, because it does go across the lifespan, and it's looking at a performance range, and as their performance range closes, you are adapting for them. So OTs include making changes in systems so that people with disabilities receive the full rights and privileges. So we're also, as we are making changes for this person, we're looking at where they may need occupational justice. We're trying to make sure that they have every right to the occupations and roles that they want and deserve. So using the contextual supports to meet the person's wants and needs, and we adapt and or alter the environment as a means for intervention whenever possible. So our strategies, we've talked about this before in one of the other, I think we talked about this. Well, we talked about this in the environment when we were talking about environment and um, how to work around our environment. And this is one of the models that really does that. So establish or restore a person's abilities, and that could be looking at the sensory motor, cognitive, psychosocial, a reestablishment of a lost skill or ability. So some examples, and they'll give you some examples on here, such as money management, parenting, leisure. We could alter the actual context or task in which the people perform. We could match a context or task to the person's abilities. Nothing is changed about the person in this one. So we're just altering the context. We may include placing the person in a different setting. Maybe it's a different setting that they need, or task. Then modify the contextual features and task demands. So we may revise the way they do something here. Okay. Prevent the occurrence or evolution of performance problems in context. So that's more about a prevention model, being proactive and look at future proactivity. Creating circumstances to promote more adaptable or complex performance. So creating is what we said without assuming that there's a disability. So we would do more health promotion with this. So if you're working on designing some sort of health promotion project, you could use the EHP model for that in a needs assessment. Strengths and weaknesses. There is a link among the person, task, and context. There are 5 different intervention strategies. There's common language to be used among all practitioners, but it needs further research on efficacy of interventions. And then there's a case study here. I'm not going to go through that. You can look through it. This is almost 30 minutes now, and I know y'all do not like those long ones. So I'm getting a little winded, and I will go over this again real quick. So ask any questions right before you present it in class, or right before it's presented in class. Hopefully this helps clear it up, and you have some readings to do for it as well. Thank you for listening, and have a great weekend.